Hi everyone, and welcome to today's part 2 of our series on hormone health with MIORA. I'm Jamie Martin. I'm the editor-in-chief of Experience Life magazine and the co-host of the Lifetime Talks podcast. And over the next hour, really excited to be here with you today with a panel of experts from the MIORA team talking about male hormone health and strategies for optimizing and balancing their hormones. We're coming to you live from Lifetime Work in downtown Minneapolis, and really excited, I'm excited to be joined by all of you. I know I've got to spend some time with some of you recently, but with me today I have Jim Lavelle, who is our Chief Science Officer at Lifetime. I have Dr. Greg Pippert, who is our Medical Director at MIORA. Cliff Edberg, who is a Senior Director of MIORA, as well as a registered dietitian and trainer. And Jeff Zwiefel, who is a health and fitness advisor to Lifetime with more than 40 years of experience. Thanks to all of you for being back with me again.
It's great
or being here for the first time.
Wonderful to join the group.
Awesome. Well, as I alluded to already, we're talking male hormone health. Last week, some of you spent time with me talking about female hormone health. Right. We're going to talk about the differences between the two, but I want to level set right from the start and talk about why we're seeing these increases in hormone health issues, regardless of sex.
Well, I think, as we talked about last week, certainly stress is playing a big role on it, and it's being identified. And I think we all realize that over the last 10 years, life has gotten incredibly more complicated with emails and text messages and traffic, right? So that's a component. Environmental burden's high. A lot of hormone mimetics in the environment, whether you're looking at plastics or other sources of environmental burden that you can get exposed to. That's a big one. And even trace mineral deficiencies. Magnesium, for example, important for testosterone production in males. So it's a variety of reasons. And look, especially for men, there's this added problem of even head trauma or gonadal trauma can actually induce low testosterone sometimes 2 decades later. So there's a lot of different reasons why this problem's occurring. And I think it's going to be great to talk to everybody and kind of unwind that.
Right. Well, you just alluded to some things that are specific to men. In addition to the head trauma, the gonadal trauma that you mentioned, is there anything else, medications or things like that might be affecting male hormone health?
Good point. One of the biggest medications being used right now are statin medications. And the statin medications, because they lower cholesterol so much, cholesterol is the compound you need to make testosterone and other hormones. And there's several studies that point to lowering of testosterone on men that are on statin medications. And I'm not saying don't take statin medications, but you may need to look at other options like going to Dr. Pippert, and you may need some testosterone replacement in addition to the medication that your internist or your cardiologist may have you on.
Absolutely.
Yeah, it is kind of dueling those two issues. We got
Yeah.
heart health,
Right.
hormone health. They're both important, and there's got to be a way to get to check both boxes.
Absolutely. Well, Greg, let's jump right in. So what might hormone health imbalances look like in men? And are they different at different stages of life? I know we talked very specifically for women, there are stages where you might notice things. Yeah. But what about for men? Because it seems like it's maybe not quite as obvious as something like perimenopause in women or menopause.
Absolutely, and that is a great contrast. As guys, it sneaks up on us. In a female, you have physical changes, you got milestones that change, cycles change, they stop. You get insomnia, hot flashes, night sweats, things that kind of get your attention to say, I'm not the same as I was 6 or 12 months ago, and I don't feel good and I don't like it, so you may seek attention. Guys, it's kind of that slow decline. Now, we can start seeing hormonal imbalances at almost any age, but things that you often hear about, erectile dysfunction, libido, the stuff that's on all the TV ads, the stuff that we talk about, low T.
Right.
That's oftentimes an end stage issue. That's when things have been around for a long time. So what we really think about when we look in retrospect are things like fatigue, low recovery, frequent injuries, weight gain, depression, fogginess. Yeah. I don't feel like myself.
No recovery.
Absolutely.
Yeah, when you think about the stats, right, it's about a 1% decline of testosterone level after the age of 30 per year. And again, huge variations, but again, adding to all the factors of that optimal vitality that we're seeking out, that's a major contributor.
Right, and so guys will often say, I didn't think that would get better. Right. Or, my stack of reading on my bedside stand is suddenly getting smaller because I'm getting through things. I can focus on things.
And breast tissue issues are big for men, right? That's a big one. And then the one thing I always see is, men will start to get what I call the whatever syndrome. The lack of enthusiasm goes away for,
Right.
hey, let's go to a game.
Right.
I'd have to get in the car.
Pass on
I don't want to do that. I'm going to pass on that. I'm just going to sit here. So, I think that's a big one because they don't necessarily get full-blown depression like you see in women where these hormonal changes can really cause anxiety and big mood disturbances. In men, they just kind of get flat.
Yeah. I think it's also a horrific, vicious cycle because, as we know, lower testosterone, gain more body fat, lose energy, lose more testosterone, and on and on. And it becomes that really difficult cycle that sometimes, at some point, you just got to figure out where you're going to break it, right?
What's interesting to me as I'm listening to you is like some of these things don't seem obviously connected to like changes in hormone levels. It's just like, oh, this is just the status quo. This is just how I am and just how life is
Part
changing.
of aging, right?
Yeah, it's part of
And
aging
supposed
for
to
all of
accept it.
us. But we don't, like I wouldn't associate, like you were saying, like some of these symptoms with hormone health necessarily.
Yeah, I think it's that slippery slope, but I do want to make a point. There's some serious consequences of low testosterone in men. For example, a low testosterone in a man, and say you have an acute event, you have to have an operation. If you have low testosterone going into that operation, you're at an 80+% increased risk for an adverse event due to that surgery versus having adequate testosterone. That's pretty significant. So we don't think of it that way. The other one is kidney function. So they gave veterans that had low kidney function testosterone in a controlled trial that actually helped those veterans with their kidney function. And so we got to start thinking about testosterone more than the sex hormone, which is important, right? Because we want to feel self-esteem, we want to feel empowered. But it really is a core hormone that denotes, am I optimized? Do I feel healthy? Am I well? And I think we kind of miss that point as well because it's a core hormone that men need in order to maintain their wellness.
But it's so interconnected with all these other hormones that affect other body systems, right? Like, so what is that? What are some of those systems? You mentioned cardiovascular health. Like, what about some of the other systems that might be affected?
Well, immune health, certainly low testosterone, guys will get sick more often. Inflammation, lower testosterone level, we tend to get more inflamed, which inflammation has really negative risks when it comes to cardiovascular health, dementia.
We certainly know that there's a direct correlation with loss of muscle mass, right?
Right.
Which is so interconnected to so many variables, from glucose intolerance to just having the energy and stamina to do the things that I want to do in life.
And Cliff, I know you see this a lot because you're in the middle of the reviews. What about cortisol and stress hormones?
Yeah, we see all the time, as Jim alluded to, that impact of stress just downregulates the production, right? It's stealing from the pool of DHEA, and you just don't simply have the foundation to build testosterone. And again, that cortisol comes from everything: your poor sleep, poor diet, lack of activity, too much activity. So there's a lot of components that go into it as well.
Yeah. So let's talk about some examples of or case studies that you've seen come through, because I know when we talk about some instances of what this might look like, it might help people relate to what this could look like for them.
Yeah.
So do you want to start,
I'll
Cliff?
share my personal story. I'll be vulnerable for the group. I was lucky enough early in my career to actually get connected with Jim and Dr. Pipper, but I was a competitive bodybuilder for many years. So going through college, paying my own way, then you have the stress of bodybuilding, which is often chronic overexercise, chronic dieting, which leads to poor sleep. And while I looked really good on the outside, had decent muscle mass, had a six-pack, inside, nothing was going well. Depression, low mood, suicidal thoughts. And I had reached out to a provider, and simply looking at me says, that's not your issue. Lucky enough to bump into Jim right when he started his relationship with Lifetime 13, 14 years ago, and we did advanced testing. And we'll talk about some of those optimal ranges. Usually for a total testosterone, we're looking at between 600 and 900, depending on the facility that you're looking at. I was sub 200.
Oh, wow.
And then again, I went to a provider with new information, and because I was 24 and looked the way I did, they dismissed the case. So I went provider to provider until I met Dr. Pippert 13 years ago, and he said, there is an issue, we need to correct it, and here's your options, right? We can go down exercise, nutrition, supplementation pathway. There's things that we can do to stimulate your body's own production, which we started with, but it didn't put a dent in because chronic stress, poor sleep, way under eating, 1,400 calories a day, doing 2 or 3 hours of workouts a day will crush somebody's metabolism. So it's not just the poor lifestyle, it's the over-exerciser, it's the hypercritical person around the diet. And eventually I had to go down a path with T-therapy that I've been managing with him every 6 months, redoing my labs to make sure I stay within that optimal range, because more is not better, better is better, to eliminate those negative thoughts, regain my motivation, protect my joint integrity so I wasn't getting injured all the time, get back my sleep, get back my drive.
Yeah. So really, for you, it ended up being a really comprehensive program, and we're going to dive into all of those factors for sure. Really, thanks for sharing that. That's a lot to be dealing with at mid-20s. Like that's not when you typically think of those hormone issues happening.
Yeah, and that's why I have such a passion. If you know me, I'm no matter who you are, that comprehensive baseline to understand where your body's currently at and what might be on your horizon, because we catch things all the time, whether it's testosterone issues, stress issues, gut health issues, cardiovascular issues, because it builds over time. It's not that all of a sudden I have cardiovascular disease, it's a process, or insulin resistance. So the earlier you can get a baseline of what health is or catch something early on, it's much easier to get back on the right path.
I've got so many of my friends in their late 50s, early 60s that have now experienced total testosterone level in the low 200s, that have night sweats, that have been college athletes, that are accustomed living a healthy, active lifestyle, that are weight training and doing cardiovascular exercise, but continuing not to make any progress, not having any energy during the day, and then finding the alternative of how to optimize their testosterone level through the methods of TRT replacement. So it's a life changer for folks like that.
Okay.
And I want to go over, there's two sides to this, because I'll give you an example of a case study of an individual that came into one of our facilities, and they were overdosed on their testosterone and were complaining of libido issues. And so their dosage got put back into more of an optimal range, which, when you look at all the research, it's called the third quartile. So kind of trending high in the normal range is where you see all these reductions in morbidity and mortality and improved health. But when you go, obviously when you're low, a lot of the guys in the 50s and 60s, they got that 200 and sub 200 with night sweats and weight gain and all the obvious stuff we just said.
No libido, yep.
But that's why it's so important that you're getting tracked appropriately, because too much can look a lot like too little.
Yeah.
And that's why I think, to Cliff's point of testing, understanding where you belong, dialing that number in. So, and I love what Greg always says, he doesn't dose to a number, he doses to how you feel.
Right.
Right? When you're really seeing improvement, okay, that's kind of where we need to be. So I think in that, like I said, in that individual's case, when we cut down and got his numbers to come down a bit, his free testosterone came back, which is a factor, it is important, along with his total testosterone still being in an optimal range. And, hey, I feel so much better. I don't understand that, right?
Yeah.
Well, it's because too much is bad, and not having enough, which is the problem of most people, that's obviously also got a lot of symptoms with it.
Yeah.
Yeah,
Greg.
actually I have a case that's a little bit kind of counter to some of this stuff. So it was a gentleman, probably about 27, and presented for an evaluation, and he had been put on testosterone by another provider, 3-4 years before. We looked at his numbers, his levels were good, he felt good, he had no side effects, everything was good, but the reason he showed up was that he and his wife were trying to have a child.
Right.
And they'd done all the testing because nothing was working, and so his sperm counts were essentially 0. So we looked at him and said, well, what can we do to keep you feeling just as well and maybe fix this issue? So we pulled him off of the testosterone.
Right.
We added some agents, clomiphene or Clomid, and HCG. Now those are agents that actually will start to tell the body to do its own thing.
Okay.
Told him just lay low for a couple of months, before they start trying again. He did the program, they tried again, successful, and then when he came back, his levels were quite good, comparable to what he was on in testosterone. Now, he was treated appropriately before. His numbers were good. But he felt just about as good, and he said, now we've had one, we're thinking we might have another, and so I'm going to stay on this regimen for the time being. So testosterone was still the issue. It's just how you fix it and how you deal with some of the side effects or complications. And so in this case, that it's just a different take on hormone replacement.
Yeah, good point.
I think that's why it's so important that at MIORA, for example, Lifetime, the way we look at this as a comprehensive panel, to look at the overall art and science of how the person's feeling, as well as how do they look according to their labs. And so I really think in terms of which markers we look at holistically, inclusive of just testosterone, which so many people are so infatuated with, talk about the other variables of that we need to make sure that we are looking at all the time, like DHT and so on.
He stole my question.
Yeah, exactly.
So the question.
And first on that, it does sound a little counter. It's estrogen. As guys, we don't think about it.
They have estrogen too.
Yeah, we have it. It's
very important to us.
It is. Our bone health, our skin health, our brain health, our heart health. It's all important, but it's all about balance. And so as guys, we obviously don't have ovaries, so we have to make our own estrogen, and we get that from testosterone through a process called aromatization. So in some guys, as the testosterone goes up comes the estrogen. It depends on how fast that enzyme works, and we're all individual. So estrogen is an important thing. We don't want it too low mood, depression. We don't want it too high. No guy wants a B cup.
And I'm one of those people, as he knows from my blood labs, that has a high testosterone, but I also have high estrogen because I'm a aromatizer. I convert a lot of my testosterone to estrogen.
Yeah, and as testosterone's in a good place, but if estrogen is too high, the testosterone can't do its job. They oppose each other.
Okay.
And one of the things too, one of the reasons for the way I think we've approached it, and one of the big side effects that occurs is men start making too much hemoglobin, and then their hematocrit starts getting too high, because when you start making a lot of testosterone, you just start producing red blood cells, and they get sticky, and then you have to go and do you got to go do a blood draw every so often. If you're not getting managed at that point of optimization where, hey, we've got the numbers for your hormones right, but it's also not driving a lot of that excess production, because, it gets tired going and donating blood as well, right?
Yeah.
So you want to try to keep people in that zone of all benefit and the risk is way down here.
Right.
Right? And so when you think of the other hormones, obviously, estradiol and estrone and testosterone, we measure free testosterone and dihydrotestosterone, which is also something that happens because of aromatization. And then, in addition to that, sex hormone binding globulin, because that is binding up your available hormone. And then we look to the other components of your health, cortisol being a big one. So we measure cortisol. We look at your insulin resistance. We look for other areas where there might be metabolic inflammation. A lot of folks don't realize your gut health has a huge impact on whether or not you're going to make testosterone, because you start to make something called lipopolysaccharide. And we talked about that previously, I think, with women. But lipopolysaccharide can actually attach to the Leydig cells of your testicles. And basically, that signal says, don't make testosterone, you don't need to.
Interesting.
And that's why we like giving a full thought of about, if you're going to enter into bioidentical hormones or TRT, think about your global health, right? Because that's how you're going to get your best health. Even Baylor School of Medicine's work, because they're one of the leading institutions publishing on men's health, along with University of Michigan. Joel Heidelbaum wrote the first textbook on men's health out of UMich. They both came to the same conclusion. If you're not going to get better sleep, and you're not going to exercise, and you're not going to eat more responsibly, chances are you're not going to get as much out of that TRT as you were planning on.
Right.
So it still comes back to those core concepts, which Lifetime is about, which is the Healthy Way of Life company. We want people to embrace taking action in their daily life.
Yeah.
And additionally, which I think is often overlooked, is, and Jim again alluded to it earlier, is some of those minerals and micronutrients. Specifically, what we always assess, especially when we're going down this path, is ensure we have a really good glimpse at magnesium and zinc levels. So both critically important for the production of testosterone, but zinc specifically helps that enzyme and the aromatization of your testosterone. So often when we're looking at a lab, we might see moderate testosterone, elevated estrogen levels. And again, if you don't have the full thought, you might bring in a medication that could bring that estrogen up, or you put in a medication that will bring the estrogen down. But if that person's zinc deficient, they're not have the natural mechanism within their own chemistry to do it. So simply adding a zinc in the evening, which promotes sleep, promotes relaxation, promotes healing,
Very inexpensive.
helps create testosterone, blunt the effects of the aromatization of your testosterone is also critical.
Yeah, I think, Jamie, it's a really interesting category, right? For 3 reasons for me. One is because, hey, you talk about testosterone in men, you're talking about the foundational thing of a man's man, right? And so it's always had this kind of taboo and stigma around it, like, and this pride thing, like, hey, my testosterone's such and such.
Yeah.
So I think that's one. I think the second one for me is that, there's been this tremendous history and abuse in the anabolic steroid category that's using 10 to 20 times the levels that we're talking about here and optimizing under medical supervision. That is not the same approach that we're talking about here for bodybuilding or for powerlifting or for sports performance. And the third one for me is the proliferation of these TRT mills that are distributing testosterone without going through the holistic and robust kind of approach that we're taking at MIORA within Lifetime. So I think it's now a wake-up call that males, men and women, have the ability and the power to control their own destiny relative to these variables. And there's no reason why they need to not be sub-optimized.
Well, and it just makes the case for why it's so important to have a team of people you're working with and who truly understand all of the nuances within this, because this is complicated. This is not something that most people are going to get their labs back and understand what this means right off the bat. Right. How do you interpret them, and then how do you put some things into practice that actually are working and then test regularly? So we're kind of jumping around a little bit, but I do want to talk about that testing because I think it's such an important element. So let's talk about what testing looks like, and if there are some other hormones. One thing I do want to mention too is luteinizing hormone was one that got mentioned. So how these tests look at all of these things and then kind of paint a picture of what's right for you at this point in time.
Yeah, so luteinizing hormone, it's from the pituitary gland in the brain. Okay. Think about it as our sensor, and it's sensing testosterone levels. And so when the pituitary gland sees lower testosterone, luteinizing hormone then gets secreted. It goes to the testicles, Leydig cells, stimulates them, and then our equipment works, and we turn things on.
Or it should.
Or it should work. You gotta have equipment that works, yes. Yeah. But so it is something then that we also look at that to see what that level is when we start. What signal's getting through? What's the body think about this? And is the body responding to it?
That's right.
And that's what Greg was alluding to earlier, that importance of that luteinizing hormone also is what helps create sperm. So if that signal's downregulated, chronic stress, poor sleep, that gets suppressed, or if you're putting exogenous testosterone and not looking at that, if I'm putting exogenous testosterone into my body doesn't need to produce it itself, so it comes down, therefore I stop creating sperm. So that's the importance of, and what we're so proud of, and I know Greg does an incredible job, is what's your goals and what's your future look like to put that full holistic plan together. Because if it's just testosterone, but we don't ask where are you going, what's important to you, and we don't dive into, you are looking for a family. Again, my personal experience as I was so young, he asked me one of the first questions, do you intend to have children? I said, absolutely. So our protocol included protecting fertility until I found that person that I was ready to create that family with.
Awesome. And to go back, luteinizing hormone, because it's from the pituitary, when I talked about head trauma, that's where you get that inhibition of your brain's ability to release luteinizing hormone. Greg alluded to the medications, enclomiphene or HCG. Those medications actually are telling your pituitary, hey, get back to work, release that luteinizing hormone, and then hopefully that's going to create a rise in testosterone, which I got to tell you, I know for you, Greg, you see a lot of men in this situation, but I've seen more and more men before the age of 30 with testosterone's like a 60-year-old.
Right.
And obviously for them, they're not at that point where, hey, I do want to think about a family. And that's why it does mean really having a thorough discussion with them and understanding their options, because, you know, what's a man going to do? Give me the testosterone.
Right.
Well, and the reality is you may need a different medication because of looking at the labs, luteinizing hormones low. Maybe it was an athlete who had a history of concussion or had a gonadal trauma, which affects the Leydig cells when you have a gonadal trauma. And, you know, it's recognizing those things and doing what's right. And, you know, there's the old saying, did you do what's right and did you do the right thing?
Yeah.
And that's what it really is about for men, because, you know, it's important that they get testosterone optimized as early as possible, as well as throughout their life, to, you know, harken back to that reduced cardiovascular risk, kidney disease risk, and, you know, all the things that come with low testosterone. Bone, I mean, there are more and more men with bone loss. We talked about that in a previous webcast, but it's not a you know, small frame woman's issue anymore. You've got men taking proton pump inhibitors, inhibiting their ability to absorb calcium, and they have low testosterone. So when a 6'3" male comes in at age 40 with lots of muscle, that means nothing to me if they're on medications that could be altering the way they absorb nutrients and their testosterone's low. They may need their bone density checked.
So in this talk, we're talking about, you know, testosterone, but yet we're hitting bone health. And if we think about, you know, what's one of the biggest scourges we have right now, it's diabetes, insulin resistance. Appropriate testosterone levels make insulin sensitivity better. So it's not uncommon for us to see somebody just glucose is riding a little higher, and we optimize their testosterone level, and now glucose starts to come down. Now, part of that also is if you feel better, you're going to exercise, you're going to be more physically active, which feeds forward. But it is, so we're not talking about, oh, I got to fix this number. It's like, wow, we fixed this number. How much other stuff is going to get better?
Right.
Yeah, so to go
all
back to the
interconnected.
original question. I know we're
Yeah. Oh,
bouncing
testing.
around,
That's
but
where we were.
So if I just go high level, and then we can spin off on some of those, looking at adrenal health, so cortisol, DHEA. Are you producing too much? Have you been producing too much for too long where it's starting to flatten out? Your DHEA is going down, which is going to be part of the production of testosterone. Looking at what Greg had just said, looking at insulin resistance, so fasting glucose, insulin, A1C, looking at thyroid health, because if your entire metabolism's shifted down, all the cells within the body are functioning just a little bit more slow, which could have downstream testosterone issues. Gut health, to make sure that we're not producing those inflammatory compounds. Cardiovascular health, and especially for males, going beyond just a basic cholesterol, LDL, HDL, well, it's a great starting spot. We know there's a lot of advanced markers that we have at our fingertips, like particle count, MPO, LP(a), like all those things will allow us to get better insights around cardiovascular health, detoxification pathways, so liver, lymph, kidney. If you aren't detoxifying, you're not going to be able to eliminate the estrogens that your body's trying to get rid of. You keep reabsorbing them, and we don't get rid of it, and that creates an imbalance. And then obviously the sex hormones, but getting a full picture, not just a total, but total, free, bioavailable, multiple forms of estrogen. That entire picture allows our providers to really pinpoint root cause issues. And while we might support with a hormone where needed, if they're in that hole and they need that lifeline, there's an entire thought around their lifestyle, exercise, nutrition, supplementation to make all systems function better.
Yep, that makes total sense. So, you know, when you think about that, all of these things are interconnected. It's never just one thing or another. It's all tied to it. But for those people who, like, you do decide, like, you know, testosterone replacement therapy is the right thing, what might that protocol look like? And are there things that someone needs to consider whether it's right for them?
Well, I mean, I think the first thing is we should talk about, well, how does it come? Like, if you're going to take testosterone, what are the dosage forms that it comes in? So, Greg, you want to highlight those?
Sure. So, the one that maybe is most commercially available that people see on TV is the testosterone creams and gels. Those are typically rubbed on daily. You know, they carry the convenience of being able to use something, I rub it on, no needles involved. But it has some negatives. You can create a lot more DHT, which can thin the hair. The biggest risk, though, is exposure to others. I mean, you got to think about this as darn near toxic to small children and pets.
Okay.
So you have to be really aware of that. Then there's injectable testosterone, which is one that I probably use a lot more frequently because it's consistent, it's time tested, you don't expose anybody else, and honestly the needles are very small and it's pretty easy to do.
And there's different ways to inject
Absolutely.
testosterone too, right?
Yeah.
So
I mean, you can do intramuscular, which is with a bigger, longer needle, which some guys that have done that say, you know, that's not for me. You can use it subcutaneously or a more shallow injection, and we use the smaller amount twice a week, so it's actually pretty convenient. And most people that inject subcutaneously say, I barely notice that. And then there's some oral forms out there. There is pellets out there, which are a sustained release form. They're not adjustable, so you put it in, you're stuck with that dose. But it's convenient, and you can't expose anyone else.
Right.
And then the issue there, of course, is pellets. There's variable hardness to the pellets. So depending on where you're going, you could have issues with it's releasing too fast, or hey, you're not releasing enough. Interestingly, there is a new oral form on the market, relatively, the last 6 months, got released into the market. I think it's pretty new, but you know, the preliminary data on it's pretty promising, and so, you know, making it something that you would take morning and afternoon to match when your body normally would be making testosterone, but you're not doing it anymore. It's matching what's called your circadian rhythm of how you make your hormones. So, you know, your hormones are made cyclically through the day and released. And so in the oral case, you would take it to match the normal circadian rhythm of a male, which would be in the morning and then mid-afternoon. And then just to go back on the injections, I think the advantage to what Dr. Pipper was talking about on subcutaneous, it kind of dissolves slower, allows you to kind of get a more consistent level, whereas when you do the deeper, what's called IM, intramuscular injection, with the bigger needle, not a fan of the big needles personally, that creates a little bit more of a rapid release of the hormones so that you're kind of doing more of an up and down experience with it. So I really like the way, I mean, I've been around Greg and have watched. I mean, you know, he just gets these nice trends to get somebody in that optimal level, and they're just riding at a very optimized level, feeling the benefits and not getting that up and down effect. So it's, you know, really it's interesting. There's a variety of them out there. I also find on the cream sometimes, at least on the patients that I've looked at over the years, sometimes they just make a lot of estrogen in addition to the DHT, and they don't get the testosterone, and you know, they just really don't get the benefit from it.
At the end of the day, it's really the form that the individual is willing to do.
Right.
You know, I can
right.
prescribe something, if it's not used, its effect is zero.
Right. And to be consistent with it. Right. Right. So let's talk about it a little bit then. I mean, testosterone replacement therapy, how common is it now? I mean, are we seeing more men, it seems, are starting to use this because they're understanding the larger health impacts, right, of not having it?
There's no shortage of guys that are asking, yes.
Okay.
Because it's out there, it's in the media, people talking about it. It is something we actually are discussing now.
Yep.
If you think about it, think about it, Jeff, how many commercials do you see for testosterone? That, hey, get it online, right? Get your testosterone, get your resiliency back, right?
I think, you know, the average consumer is starting to get highly educated that the unfortunate reality with their primary care doc using traditional age-related norms is not something that they have to be confined to.
Right.
And that there's an opportunity to ensure that they run at the right optimal level that, again, considers a holistic approach, with the bedrock being, as Lifetime with MIORA, that lifestyle through diet and exercise are those key foundational elements that people start with. But I think, as this group discussed with GLP-1s, it does provide people the opportunity to move beyond the frustration that they're trying to fight against with the significant headwind of a tremendously deficient total testosterone level in that, you know, 100, 200, 300 range. You know, the range is broad, right? 250 to 900 to 1,000. So, you know, I think we've been talking about this 600 to 800 to 900 range where we'd like to try to have people within. So I've just seen life-changing experiences with most men that have encountered this and are monitored in the right way.
So to go back to testing for just a second, so you're saying obviously testing your testosterone. Are there other specific tests that people might not be able to get elsewhere? And if it's not part of a standard lab panel, that they should be asking for if they want more details around these things? Like what, if someone's going to more of a traditional doctor, like you mentioned, Jeff, what are the tests that someone should ask for to get more specific?
Well, clearly the DHT, the sex-binding globulins, I mean, we need to look at cortisol levels. We need to look at free and total testosterone. These are things, and the lipid profiles, as Cliff was talking about, a traditional healthcare provider just isn't going to go that deep.
Right.
By contrast, you'll probably get 10 to 12 blood biomarkers from your family practice doc, where we're doing 95 to 200 in terms of understanding and uncovering the connective parts that we need to make sure we're looking at holistically. Because as we're all talking about, is they are all interrelated so importantly. So one can dramatically affect the lever of the other.
Yep.
And so again, we as healthcare providers within MIORA, these gentlemen can ensure that we are also able to distill this down into simplistic, adhering opportunities for people to build into their own lifestyle. It's this job to ensure that they interpret the complexity of this and what does it mean to me?
Yes.
Well, and I'm going to just ask Greg, how often does a 25-year-old get their estrogens and testosterone, much less their cortisol checked? No, or luteinizing hormone or DHT, the full gamut of what it is, but it's not very often, right? It's just because it's just assumed that, oh, you're 25. Just like what happened with Cliff. And you look at Cliff and he's got a little bit of muscle on him. This guy's yoked. But I mean, you don't think of that. You look at him and go, oh, wow, that guy's dripping with testosterone, right? So you don't think, a man, his age group, that's the core issue, but yet it was life-altering for him.
Right.
And I think it's one of my big things that I've seen is that when you have and look, it's a consumer's drive to the health market. Let's make no mistake. Mm-hmm. Why have TRT, if you want to call them mills or clinics, but the folks that are just going through maybe 100 people a day, why have they populated? Well, part of that demand is, hey, I'm a 25-year-old and I know something's not right. And to Jeff's point, conventional care didn't take care of it. I'm going to make a beeline to my fastest solution possible. And they just may not be aware of all the things that we've been discussing of, the complete process of why did you get there to begin with. You got to discover where you were to understand where you were going.
Yeah.
And
the long-term implications of those decisions, right? We're talking about many times with a younger patient, there are many more intelligent solutions than just defaulting to TRT.
Right, and so that brings us to kind of what are some alternatives, and then we want to talk about lifestyle too and what role that plays in. So are there natural alternatives or other alternatives to testosterone that should be considered?
I'll let you address the natural.
Yeah, I mean, I've been around, obviously I've written databases on natural compounds, but mainly with educating at the American Academy of Anti-Aging Medicine, talking to a lot of urologists. There are natural compounds that will raise your testosterone 100 to 200 points. So there's a fenugreek extract called Testofen, which has been studied in men and women, by the way, because as we discussed last week, women need testosterone as well. And it's been reported in multiple studies to be beneficial. There's another compound called uricoma, Uricoma longifolia, the common term is longjack. Another compound that in doses of 100 to 600 milligrams, typically where you saw the most benefit was 300 to 600 milligrams a day, really has a significant benefit on improving testosterone, reducing symptom scores related to mood, and improving their stamina and strength. And that was actually reported in the International Journal of Sports Science. I mean, so there are natural things that you can reach for if you're at that borderline and maybe you're a little gun shy about starting medication, and maybe you want to start with a nutrient, think about zinc, think about magnesium, think about getting more resistance training, getting with a trainer that can really work with you so that, there are natural compounds that can help. And of course, I think, the discussion that Greg had regarding, how to turn your pituitary back on, I personally try to encourage most of the young men coming in, if that luteinizing hormone's down, we want them to try to get their body making their own testosterone again, get them back to doing what it should be doing.
Yep.
You have the equipment, let's let it do its job.
Right. Okay, so let's talk about what some of those strategies are. I mean, you wanted to, well, actually, I'm going to stop myself. We're going to go back to the alternatives.
Okay.
Not just natural alternatives.
Alternatives to testosterone.
To testosterone.
Yeah. So as we talked about, or as I did with that previous case, so HCG. HCG is classically the hormone we think about as, hey, you're pregnant. It's the one that makes the nice blue line on the dipstick. But HCG in the male is a surrogate for luteinizing hormone. And so you put HCG in the male, it's typically administered as an injection, and it goes right to the testicles and tells them to work. So that's a nice solution. It is an injectable product, but it's really taken advantage of our own body. Then there's Clomid, or it's transisomer and clomiphene. So those go to the pituitary gland, and they trick the pituitary gland a little bit into not seeing estrogen. Now that sounds a little perverse, we're talking estrogen now, testosterone, but the pituitary gland then will respond going, I don't have hormones, I need hormones, so then it amplifies that signal to the testicles and turns them on, again, making our equipment work.
And it's an oral.
And that is an oral, yeah. So that's easy to take, and it's a few times a week. It's a great solution, both Clomid and clomiphene. And I don't know what you guys' experience has been, but if you had talked to me 10, 15 years ago about Clomid and clomiphene, I would have said, well, that's an awesome solution when you're 20. Beyond that, you're yelling at something that can't hear you. I have guys in their 40s, 50s, and older that are still responding to those agents.
Well, and I'll share a story because my son lets me share this story, so I'm not violating any HIPAA issues. But son was a college football player, played linebacker, Division I, Texas Tech. Came out of college, and he just wasn't feeling right, wasn't feeling well. And when you're playing that position, you're going to get into a few skirmishes. You're going to hit pretty frequently as a linebacker. I remember doing his testosterone, just said, hey, let's just check it all. And he had a 169 testosterone, which is equivalent of about an 85-year-old male who's hypogonadal, right? I mean, it's really bad.
That doesn't feel
and we used clomiphene in that case, our medical doc on our team.
I'm really surprised he was able to do the workloads that he had to go through.
Amazing, right? Well, it's amazing what your mind will do, right?
Yes.
But he was able to use clomiphene, and his numbers came back 869 and then 925. And then was able to utilize that for a period of 6 months, get off of it, and it actually reset the signal for him. So he's no longer needing to use that medication. But it was that bridge or that lifeline to kind of get things connected again and get him, once again, feeling whole. Very similar to what Cliff was feeling. I mean, that was actually pretty
And
dramatic.
my son, by contrast, is a 22-year-old who tried Clomid, but it didn't work for him. So again, very individual results.
Exactly.
And that's why we have to continue to follow up and find out what works and what doesn't work.
Well, and that was going to be my follow-up question: is how quickly do these things work, and how frequently? Again, about every 6 months to make sure you're assessing and making adjustments. I'm assuming so that you're in the right spot.
Yeah, it would depend on the path you go, right?
Right.
When you're talking about, I'm going to really work on my sleep, work on my nutrition, work on my supplementation, work on my mindfulness, work on intense, like that can take some time to do it.
Yep.
Then you go to the contrast, a medical therapy is weeks to start to feel better, and then there's a spectrum of how every individual reacts to it.
Yeah, I mean, that 3 to 4 weeks on starting to change the numbers in a dramatic way, I think you can see. But 3 to 4 months probably to start seeing, the physical changes of body composition.
Yeah, depending on the individual and
Yes.
what else you're putting into the effort, right? If
Right.
just doing the therapy without adjusting exercise, nutrition, lifestyle.
Yeah,
Yeah.
but libido can change as little as 3 weeks.
Right.
But it's not like
yeah.
caffeine where you do double espresso and you walk out the door
Yeah.
feeling better.
Yeah.
This is something that, testosterone's a signal. It's got to
Yeah.
tell the body to do something, and the body actually has to do it, which
Yeah.
takes time.
But what you're saying here is like it's never just like it's not just one lever that you're using, or it's like it's part of a comprehensive program. How does it fit in with, again, the pillars that we often talk about at Lifetime, or movement and fitness, nutrition, mindfulness, and all of those pieces, and even just like the social connections that we have, like those things matter in the grand scheme
and
of
that's
it.
the important thing that we can chat a little bit about. You talk about natural ways.
Yeah.
Right. In natural ways, we know it is the bedrock. It starts with strength training.
Right.
I mean, strength training is such a vital part that is a common discussion we're having. And I think that's why we're seeing 181% growth of strength training users in clubs today, right?
Mm-hmm.
Because they're recognizing how critical it is in terms of stimulating testosterone productions a natural way. So specifically, compound movements, squats, deadlifts, that using somewhere between 6 to 8 reps have been shown, heavy weights then, right, to stimulate greater amounts of the body's natural testosterone production, right? And I think the other piece that we know physiologically works on hormones and the neuromuscular and the physiological side is high intensity training, HIIT training. At least 1 or 2 days a week doing high intensity training through some sort of significant elevated heart rate with some sort of recovery. The great thing about that is stimulating the body's own natural testosterone production, but also human growth hormone levels, right, naturally.
Right.
And so doing that before engaging in some sort of hormone replacement and or in combination with it is the way that we would approach this within the MIORA program, right?
Yep.
And there are the at-risk people or persons that are training. For example, if you're an endurance athlete and you're running long distances and your cortisol levels, you're training your cortisol because your body thinks you're running from a white tiger for 20 miles.
Right.
And you never run from a white tiger for 20 miles. It either catches you in the first
Well, I
100
have
feet,
for 20
or you're up the tree, right? You're never going to get there, right? So when you're running that kind of distance, you raise those cortisol levels. That kind of puts you more at risk because as that cortisol is going up, once again, what happens is it blocks the release of something called gonadotropin, your gonads, gonadotropin releasing hormone. This happens in men and women, by the way. And so when you block gonadotropin releasing hormone because of that cortisol being up, because you're engaged, and I'm not saying don't do endurance events. I'm just saying understand the implication of that because to Cliff's point earlier, you can be more prone to soft tissue injuries. You can be more prone to bone loss and stress fractures if you don't have optimized hormones while you're going through that. So there is that idea of, well, what kind of exercise do you do? Right. And is that something that's putting you at risk? And therefore you should even be more forward thinking about getting a very comprehensive lab test to look at cortisol, to look at your sex hormones, to see whether that's something it's not just limiting your success today. Maybe you're not dealing with a chronic injury today, but you don't want to get one in your next event either. Right? So it's really important to think about both sides of that.
It's got that preventive element to it as well.
One thing I would add to what Jeff said, because it was completely correct, but I see there's kind of a couple spectrums of this, is the 6 to 8 is the rep range you reference, but it's the actual pushing yourself to fatigue, because just doing 6 reps or 8 reps isn't the answer. It's pushing yourself to a point that you're reaching and approaching failure to challenge
Why the
the body.
heavy weight is so important.
Yeah, and then on the other side, you can be doing those things and pushing it really, really hard, but if you're not recovering, you start digging yourself a bigger hole. So if you're just getting into, I'm gonna start doing high intense exercise to start pulsing my testosterone, good thought, but are you protecting your sleep? Are you getting enough protein?
Are you periodizing? Yes.
Yeah. Are you challenging the body differently throughout time so that you're not putting on the same intensity consistently? So again, you need to be cognizant of the full thought. And unfortunately, without a provider like Greg, on your team, like you just need to make sure that you surround yourself with those professionals that can get a good understanding of what's your exercise. Is that something you could handle? So it's either you're overtraining or under recovering, right? And putting those puzzle pieces together.
As you and I were showcasing before we went on today, our sleep scores from last night. From our 8 sleep, I was 100. So
I had no idea you were going to bring that up once you said that.
I'm not sponsored.
Got
my point is,
obviously,
we've all been talking about the importance of sleep for longevity, of course, but the significance of testosterone production during REM sleep and how vital it is that is optimized as another natural way to try to ensure that you're producing your body's maximum amount of testosterone.
And everybody's looking at these numbers now. So, once again, if you notice your resting heart rate's going up, your heart rate variability is going down, your 2-minute heart rate recovery, you're no longer at 12 beats per minute post-exercise as soon as you stop. If you're seeing those things erode, chances are you're starting to dip into that reservoir of hormones. You're starting to going to see a shift, because that's a sign that you're under-recovered. And to Cliff's point, dramatic things can start to happen over time, because we tend to ignore those things, right? Hey, I'm still training hard. I think I'm going to push through that.
Well, I always think it's interesting, obviously visiting our clubs regularly and going on the workout floor. Oftentimes, I'll be there 3 or 4 days a week, but the same people are there every time, and I'm hoping that they're doing the same thing every time, and I'm hoping they're taking the other days off to do some recovery. But I often think it's kind of the same thing over and over again, but I'm always here, and there isn't that downtime to recover. So in some ways, if we're over-exercising, not giving ourselves the space to truly be as healthy as we could be, right?
Yeah, you just start broken down muscle, and if you don't have the hormone that's really the essence of recovery for a male in testosterone, you're just breaking down more and more.
And on top of that, not getting the high quality protein as well as we know with testosterone, you said, omega-3s, zinc, vitamin D, some of the just vital staples through our Lifetime Health program that we really want to make sure people put in their repertoire.
Any other foods, natural sources of certain nutrients that you would recommend that men should be eating more of to support hormone health?
Good fats. I would really encourage, healthy fats. Because of the reasons we've talked about earlier.
And I think maybe one to avoid would be the chronic overuse of soy in your diet, because that could promote, again, not to avoid soy, don't have to, when you go out to sushi, avoid the edamame at all costs, but there are people that I've worked with in time. I'm somebody that is dairy sensitive, therefore I regularly use soy protein, and that overconsumption in a male could produce extra estrogens.
Got it.
And once again, just to go back to which nobody likes hearing this, they should be eating more vegetables. Vegetables are mineral rich. Vegetables help to alkalinize and reduce your oxidative stress in your tissue. Why that's important is when you reduce the rate of rusting, which is oxidation, right? That means you're going to be able to recover better. And when you recover better and you take in protein, now your body can synthesize muscle tissue. And you got to remember, the reason that hard training is so important is it literally does trigger inflammation in your tissues. You increase inflammatory cytokines in your tissues, but the problem is if you never let them trigger the growth that's supposed to happen, you just keep compounding the inflammatory response. That's where you get into the problem, and why nutrients are so important. Really, working on adequate protein intake. Don't forget those vegetables. Get the healthy fats in. Watch the estrogen-related foods like soy. It's probably the biggest one, right? That's the big.
And then, Jim, maybe with the vegetable, maybe you'd go a little bit deeper on the fiber component when it comes to vegetables, or just fiber in general.
Yeah, I mean, once again, when you take in adequate fiber, I would say your minimum target should be 30 grams a day. I encourage people to get between 30 and 40 grams a day, because fiber helps your microbiome make healthy bacteria. And I know it sounds a little strange, but if you don't have healthy bacteria, you have unfriendly bacteria, and unfriendly bacteria secrete an enzyme that will make you recycle your estrogen. And so as men, we want a little bit of estrogen. We know it's important to have estradiol, but we don't want to store free estrogen and then start to have more what's called that aromatase being made in your belly fat, because that's what happens is you make more aromatase, and now you're making more DHT, your hair's thinning, nobody wants their hair to get thinner, in addition to the other side effects.
In addition,
It's overrated for you.
Probably make my life easier, actually.
you get
Yeah, exactly.
get ready in the morning a lot faster than I do. But to the fiber, also soluble fiber actually just helps you to excrete estrogen in itself, and also cholesterol. So we see decrease in cholesterol with fiber, which helps improves our heart health, and on two different spectrums, it improves our estrogen levels as guys in a natural way.
Yeah.
Okay, we've covered a lot of ground here, and I just want to take a moment to kind of synthesize what we've been saying, because I mean, there's a whole bunch of different factors here. I mean, one, hormone changes can happen really at any stage in a male's life, right? Like from 20s up to beyond, like things are changing, and there's a lot of things we can do to help ourselves, whether it's help yourselves in this case, not myself, but to take care of ourselves, from the lifestyle factors to the hormone replacement therapy. How would you help people bring it together? Like, what's one thing you want to leave people with today so that they have a takeaway, a next step for themselves, or something to think about?
Well, I'm going to start with the 18-year-old because there's a lot of 18-year-olds that their diets aren't that great. They're not getting sleep. They're up late at night, right? Not playing. Nowadays, a lot of them playing video games.
Yep.
And then the other thing that's come up that we didn't mention is that there's a category of compounds called SARMs that the 18-year-old category, it's kind of like, hey, I can get this anabolic agent, and they can go into health food stores and buy these. They're not for human use, but yet they can still get them. They can buy them on the internet. And when you take a SARM, it's a selective androgen receptor modifier, typically in a liquid. It blocks your testosterone receptors and blocks your ability to make testosterone. And I've even had sub-20-year-olds with double-digit testosterones in the 80s or 90s because they wanted to back when I lived in California, got to get lean, it's surf season, right? And they go into the health food store, hey, what can I do to kind of bulk up? And not saying that these don't have a positive impact on that, but I think you got to start thinking about this right away. Obviously, the other lifestyle choices and things we've talked about are important, but there's risk factors out there that are happening at a very large scale that's also influencing that younger and younger population.
Yep.
So that's the one point I also wanted to make sure I made in relationship to that. Where do we begin to think about this?
Yeah, absolutely. Greg.
Testosterone's not the end all. I mean, it's just not. You know, I think it's presented as something that if I just take this injection or I rub this cream on, everything's going to get better. I'm going to feel better, and that's really not what happens. It's a piece of it, but if we don't do the other stuff, it really doesn't work, not that well. And so, as we've been talking about here, that's the reason why we put together a system where we look at everything, we consider everything, we try and fix the things that need to be fixed so that the testosterone can work better and do its optimal job, or maybe even not need the testosterone.
I would say I just go back to where I started and urge the importance of testing, and testing early before symptoms. So even if you're a 24-year-old and you test your testosterone and everything looks great, you have a baseline. Because again, that erosion of health and our peer groups eroding with us, I'm just like everybody else. But if I know what well felt like and what my body used to be capable of doing, I can catch that drift much sooner, and I can do an audit of my lifestyle, my supplementation, my sleep, all of those things, so I can either get myself back on track or get out with somebody that can use more of a holistic, natural approach to get my body on track versus having to jump to something, because it is something that a male would have to continue to do. Yep. If you offset where you're feeling to where you would be, it's often well worth the investment of time, money, and effort. But again, testing earlier, testing often is really critical.
I mean, it's proactive health, right? Like, let's be proactive versus reactive in many cases.
Yeah,
Jeff.
I think that men have the power to control, their vitality of their life right now through optimizing their hormone levels. But they need to look at the three things, right? Look for board-certified medical practitioners, look at their track record and experience in dealing with testosterone replacement therapy. Look at the reviews of that site and their track record to see how successful they've been, and make sure you don't just jump into it. Again, does the group that you're working with do the holistic blood panels like we do, and do them on a regular basis to monitor and follow up on what's happening?
And have a holistic approach.
And have a holistic approach, and making sure that the bedrock of it is the exercise, strength training, diet, and lifestyle. So,
Bring it right back to that healthy way of life.
yep,
I love it.
never changes.
Right. Well, thank you all for joining me today. I know for anybody who's tuning in, you will be able to find this part 2 of our series on hormone health in the Lifetime app. You'll also find part 1 on female health in the LT app as well in the coming days. And in the meantime, we want to encourage you to check out MIORA.lifetime.life to learn more about the services that this team is providing. And be sure to tune in for future educational sessions like this coming up. We're excited to do more of these going into next year. So thanks everyone for tuning in. We'll see you soon.